All right, welcome. I'm so glad you're here. Today and during this class, we're going to be talking about plantar fasciitis. So plantar fasciitis is one of my favorite things to treat, primarily because I feel like there's a lot of misinformation out there, and it's not easy to treat, but there's definitely a lot of things that can be done in order to help people get better. And I feel like most people feel like they've tried everything, but nothing has really worked. And usually what happens, or the reason that happens, is because they may have tried everything, but they didn't try it for the right amount of time. So I always like to say, dosage makes the medicine. Certain substances that you take, if you take them at a small dose, it's totally fine, it's medicinal. But if you eat too much of it, or if you take too much of it, then it actually can cause problems. So that's something I see with plantar fasciitis, or that same kind of analogy. So let's go ahead and jump into the course here. So learning objectives for the plantar fasciitis course is understand the anatomy of the foot and the lower leg. That's where we're concerned when there's plantar fasciitis. Introduction to the joint-by-joint approach. That is what I use when treating plantar fasciitis. Review motion of the joints of the feet and the lower leg, and explore a patient-centered approach to foot pain, and then review the self-treatment options for plantar fasciitis. So that's what we're going to be covering in this class. All right, so basics of plantar fasciitis. So you can see over here in this foot model, this is the plantar fascia. This is the sole of the foot. This is the heel bone here. These are the toes here. These are the different tendons come off of the Achilles tendon. And then we have the plantar fascia. So the plantar fascia covers the whole sole of the foot. And so basics of this injury of plantar fasciitis are, it's an overuse injury. I think this is what most people get wrong, is they don't realize that plantar fasciitis is an overuse injury, and they don't realize that it's a repetitive strain injury, and they don't rest long enough or well enough. And so they keep re-injuring themselves. So that is the biggest problem that I see in terms of recovery. So even though it's called plantar fasciitis, and fasciitis means that there's inflammation of the plantar fascia, it's not a true fasciitis. It's actually a tendinosis, or a collagen degeneration. That would be a fascianosis. It basically, there's degeneration of the collagen in the plantar fascia, and so the plantar fascia isn't as strong, it isn't as resilient as it used to be, and so anytime there's degeneration, we need to rest that tissue so that it can regenerate. So bone spurs, pronation, tight calves, they can all predispose you to plantar fasciitis, but they rarely cause plantar fasciitis. So a lot of people will over-focus on bone spurs or pronation or tight calves as the answer. And really the answer is rest. Really figuring out a good rest routine to allow the degeneration of those collagen fibers in the plantar fascia to heal. That's really the best way to go about it. If you feel strong burning or sharp pain in the arch of the foot, close to the heel, behind the toes, and sometimes throughout the most part of the bottom foot. So this is basically the description of plantar fasciitis. It's worse in the morning. And so sometimes I find that people don't actually have plantar fasciitis. It's just kind of the most common Google diagnosis of foot pain. So you really want to look for this burning or sharp pain in the arch of the foot, or close to the heel, and sometimes behind the toes, and through the entire bottom of the foot. If you're just having pain in one area and not another area, it might not even be plantar fasciitis. And the signature thing that your physician or your chiropractor or your pedorthist or your or anybody that you're working with is going to look for is morning pain. So that's considered a signature symptom of plantar fasciitis. If your pain is worse in the morning, it's most likely that this is what you've got going on. All right, so moving on here, the arches of the feet. So the plantar fascia works with the muscles and the ligaments and the tendons and the bones of the feet to create these 3 arches. And each of the arches have kind of a different function or a different primary function. I mean, they all of their functions overlap, but the primary function. So, one of the functions of the arches is stability. So the stability is created by basically making the foot a tripod. And so the weight is spread over 3 points. The heel and the balls of the big toe and the balls of the small toe. And so then it's basically like a triangle that's created, and that gives you a lot of support. And so it's the lateral longitudinal arch that primarily creates this support function. Another major function of the arches is acceleration. So when you're running, when you're walking, the arch will accumulate kinetic energy and then release that kinetic energy. So it's going to help you accelerate when you're moving. And so the arch that's primarily responsible for that is the medial longitudinal arch. That's the primary driver of propulsion. And I'm going to go into that a little bit more in depth here. The last function here is shock absorption and protection. The feet do absorb shock, especially with high shock activities. And so that can have a protective function on the other joints, on the knees and the hips and the low back. So the feet serve as a shock absorber. So there's kind of a spring-like activity where it stores that kinetic energy. And the particular shape of the foot, of the arches, is used to protect the nerves and the blood vessels that go into the foot. And so if the foot is misshapen, then sometimes the nerves and the blood vessels can be compromised because of that. So we talked about the 3 arches and the 3 arches of the bottom of the foot. And now we'll look at the 3 components. So we already looked at this. This is the plantar fascia. This is, considered the primary component. This is where the overuse injury happens, and this is also the place where the degeneration of that fascia happens. But the sole of the foot is continuous with the lower leg muscles. So the gastroc muscle and the soleus muscle, they have a common tendon, the Achilles tendon, and then the Achilles tendon wraps around to the bottom of the foot and becomes the plantar fascia. So the lower leg muscles play a big role in plantar fasciitis. And then of course we have the bones of the feet. So I have the bones listed here. You can see there's quite a few bones in the feet. There's as many bones in the feet as there are in the spine. And so if there's damage to the bones of the feet, if there's a particular structure of the bones of the feet, that can also contribute to plantar fasciitis. So going in depth here, or a little bit more in depth into these arches that I introduced, we're going to kind of look at the 3 primary arches. So we've got this tripod again. Base of the big toe, base of the little toe, base of the heel. Those are our 3 points of contact. And then I have, have this, that's from the bottom, and I also have this image looking at it from the side. So the transverse arch is from A to B. So that's your transverse arch there. A to B. That's the anterior transverse arch. And then from B to C, we have the lateral longitudinal arch. So this is the outside of the foot here. That's the lateral side of the foot. And it's going long, so lateral longitudinal arch. And then the medial longitudinal arch. So anterior transverse, lateral longitudinal, medial longitudinal. Those are the three arches of the foot. So when we look at that medial longitudinal arch, we're primarily looking at what's going on the inside of the foot, on the inner arch. And that's really what most people think of when they think of the arches of the foot. They think of that one arch. And so we're going to look at all three of the arches, but this is the arch that's most often associated with that. So we'll go ahead and, so this plantar aponeurosis here, that's basically your plantar fascia. So you can see the plantar fascia here, and then the muscles are working to basically create this arch. So we have the tibialis posterior muscle drawing up here. Then we also have the flexor hallucis longus muscle that's connected to the toe, flexes the big toe down. We also have the abductor hallucis muscle here. That's a muscle that's also working with the big toe, and a big muscle that's involved in bunions. And then it's got all of the, the bones of the feet labeled here. We've got the spring ligament here that's holding that tibialis posterior muscle in place. And so it's the tension on these muscles that's helping to form the medial arch. So we can see that flexor hallucis muscle again. And then we're also looking at the tibialis anterior muscle. So that inserts very close to where the posterior inserts, but it goes to the front of the shin instead of the back of the shin. And so all of these muscles are working in order to maintain the medial arch. So the primary ligament that's involved here in the medial longitudinal arch is this spring ligament. You can see the spring ligament is just below the talus bone, just in front of the calcaneus or the heel bone, and just behind the navicular bone. And it's also where that tendon was going through there back to the posterior tib. And so this is one of the primary ligaments that's used to maintain the medial longitudinal arch. So next we're looking at the lateral arch. So again, this is from the outside of the foot, and we're looking at the muscles that go down the outside of the leg into the outside of the foot. And so the big ones are the peroneus brevis and the peroneus longus muscles that attach here and then draw themselves up the side of the leg here. And it's that pulling action up the side of the leg that creates that. And we also have the short and long planar ligaments here that are also being used to maintain that lateral longitudinal arch here. So last is this transverse arch. That's the one that goes from A to B. And that one sometimes is, sometimes delineated as an anterior and a posterior transverse arch. So the anterior ones that I have depicted in this picture, and the posterior transverse arch is formed by the heel bone and is really only a half dome, so contact with the ground. So it's a much smaller arch in this area. And so it's only a half dome unless the feet are brought together, and then you have the full posterior transverse arch. So we're going to primarily focus on the anterior transverse arch here. So this is just kind of an outline of what I've talked about so far. You've got the medial longitudinal arch and the lateral longitudinal arch. And so just kind of a comparison. Medial is formed by more bones, more joints. Its characteristic feature is resiliency. It's higher. It's what we think of when we think of the arch of the feet, and it's more mobile. It's involved in propulsion. Its summit is formed by the talus bone. I pointed that out in one of the images here. And the main joint is the talocalcaneonavicular joint. So we looked at the muscles that attach to those bones and help create the joint. So lateral longitudinal, less bones, less joints. Characteristic feature is rigidity. It's lower, so it's less mobile. It's involved in receiving and supporting body weight. Summit is formed by the calcaneus, that's the heel bone, and the main joint is the calcaneocuboid, which is considered the most vulnerable part of the joint. And the cuboid is just in front of the calcaneus on the lateral side of the foot. So that's a comparison between those two arches. So we already looked at this, but just to review, lateral arch, stability, medial longitudinal arch, acceleration or propulsion, and then the whole foot and all of the arches of the foot are used for shock absorption. Oops, let me go back. That's not working. Anyway, they're used for shock absorption. So now we're going to get into the assessment.